Hello, I'm Teresa Detweiler, a certified prevention specialist with the Council on Chemical Abuse. This presentation is on vaping and JUULing information for parents. The Council on Chemical Abuse is Berks County's single county authority for alcohol and drug prevention, intervention, treatment, and recovery services. There are currently 460 different e-cigarette brands on the market. It doesn't matter what they're called, vapes all work in a similar way. Vape pens, e-cigs, etc. Students should understand that no matter what it's called, vaping, JUULing, or what they're using, mod, pen, JUUL, drop, or e-cig, they all do the same type of damage to their bodies. Vaping is the act of inhaling and exhaling the aerosol, often referred to as vapor. The term is used because e-cigarettes do not produce tobacco smoke, but rather an aerosol, often mistaken for water vapor, that actually consists of fine particles. Many of these particles contain varying amounts of toxic chemicals, which have been linked to cancer as well as respiratory and heart disease. I tell students that they are all drug delivery devices with the sole purpose to deliver drugs and chemicals into the body. Therefore, they all have the potential to cause harm. We hear a lot about the brand JUUL because they were the first e-cigarette that was really popular among youth because the company deliberately targeted youth. Prior to the invention of JUUL, e-cigs were mainly targeted towards adults, especially adult smokers. The JUUL changed the vaping landscape with its sleek and concealable design that could be easily hidden, which made it perfect for youth. Now there are lots of JUUL copycat vapes and compatible products being sold. These cartridge-based e-cigarettes like JUUL contain nicotine salts that do not always produce visible emissions when the device is used and may make the product even more addictive. So most adults might remember the big tobacco companies being sued by the federal government back in the 1990s. Well, guess what? We now have Congress examining JUUL's role in nicotine addiction and the youth e-cigarette epidemic. And back in February, Pennsylvania and 38 other states are suing JUUL and calling for new legal proposals on their products. Some of the things that we know these companies have lied about are their marketing tactics towards underage youth. During the July 2019 testimony at the House Subcommittee hearing, there were statements that JUUL reps told high school students its product was totally safe, safer than cigarettes, and the FDA would approve it any day. We also know that JUUL targeted youth as young as 8 years old with community and school programs. They also lied about its safety. There's no peer-reviewed research that indicates it being safe. The vaping illnesses we are seeing seem to show that vapes are unsafe, and there's no clinical trial that shows any vape to help adults quit smoking. And finally, they lied about the nicotine content in nicotine-free e-liquid. E-liquid that was tested that had claims to being nicotine-free has shown trace amounts of nicotine. As of February 18, 2020, we had 2,807 e-cig and vaping product use associated lung illness hospitalizations. This condition is known as EVALI, and also 68 confirmed deaths. It's important to note that these are the numbers reported for hospitalizations only. These numbers do not reflect the amounts of people that got sick from vaping but were not hospitalized. There's still no identified cause for this condition. The only commonality is vaping. However, all people who developed EVALI report a history of using vaping products. And although most report use of vaping THC, some report only vaping nicotine products. So it's not just vaping illegal or black market products that was making people sick. It's also important to note that due to the COVID-19 and the coronavirus pandemic, the CDC stopped reporting on EVALI cases. However, several health organizations have stated that people who smoke or vape are at much greater risk for the coronavirus. Here is a list of the short-term effects associated with this lung injury. These effects are short-term, meaning that the person developed them within 90 days of vaping. The CDC has two classifications for vaping-related lung injury and death, confirmed and probable. Each case must meet the following criteria to be considered a vaping-related lung injury or death. First, using an e-cigarette or vaping in 90 days prior to symptom onset, meaning the lung injury we are seeing is directly tied to current vaping. It is not a long-term result. Unlike developing cancer from smoking traditional cigarettes, this is something that happens because a person is actively engaging in vaping. They're also looking for pulmonary infiltrates visible on x-rays. Pulmonary infiltrates means that there is something more than air and healthy lung tissue in your lungs. What is typically causing this denseness in these cases is inflammation and swelling of the lungs. Also, there's an absence of pulmonary infection on initial workup, so negative results on respiratory viral panel, influenza flu test, and all other clinically indicated respiratory infectious disease testing, meaning there's no other infection that could be causing the other symptoms. This is the distinction between confirmed and probable. A confirmed case meets the criteria, while a probable case has some other infection involved, but the clinical team does not believe it to be the sole cause of the other symptoms, or the test results were unattainable or inconclusive. Unfortunately, a lot of times people wait too long to go to the doctor and develop other sicknesses when what's really making them sick in the first place is vaping. And also, there's no evidence in medical record of alternative plausible diagnosis, meaning there's no medical history that could otherwise account for these symptoms, like a pre-existing cardiac issue, autoimmune disease, or tumors. So here's what happens. Aerosol-containing chemicals enter the lungs, irritation and inflammation starts. Your body recognizes something's wrong and sends a type of white blood cell called macrophages to help out. The macrophages eat the chemicals brought in by the aerosol because they know these chemicals shouldn't be there and are causing issues. The macrophages can sometimes digest this aerosol, but not always. So some of the aerosol stays in the lungs and kills the macrophages, and things get more irritated and inflamed. Since some of the chemicals brought in by the aerosol aren't being removed, they further irritate and inflame the lungs. Over time, if you continue to vape, more of these chemicals will build up. Eventually, the lungs become so irritated and inflamed, a person isn't able to breathe or process oxygen. The inability to process enough oxygen is what is killing people. You can see the swelling and irritation in the lung x-ray with the damage from vaping. Possible causes of this condition are lipids. E-liquids contain known oils like glycerin. Vitamin E, which is used to cut cannabis for use in some vapes. Vitamin E is safe to eat but has known to cause significant lung damage when inhaled. Flavoring chemicals. These flavoring chemicals have shown to actually change the genetic makeup of the cells in your lungs, which could impair the production and function of parts of your lungs. What about teen vaping numbers here in Berks? Locally, we use the Pennsylvania Youth Survey that is administered to students in the 6th, 8th, 10th, and 12th grades to learn about their behavior, attitudes, and knowledge concerning alcohol, tobacco, other drugs, and violence. This survey is administered every other year, so it was just completed in 2019. After alcohol, the second most commonly used substance by students in Berks County is vaping and e-cigs, and chances are these vaping numbers are even higher. We'll have the 2019 data available on April 30th, 2020. What we also find from the PAYS data is that kids are greatly misinformed about these products and think they are vaping just flavoring, or they really have no idea. You will hear the term e-juice often used to describe the liquid that is vaped. Why would a vape call it e-juice instead of e-liquid? The term e-juice helps lower the perception of harm. Juice is harmless. Kids drink juice. Juice is water. Juice is natural. Juice is safe. E-liquid juice is not safe. It is chemicals, oils, and unknown flavorings. Let's talk a little bit more about what is actually in e-liquid. The e-cigarette aerosol that users breathe from the device and exhale can contain harmful and potentially harmful substances, including volatile organic compounds, nicotine, ultrafine particles, cancer-causing chemicals, heavy metals such as nickel, tin, and lead, flavorings such as diacetyl, a chemical linked to serious lung disease. The Surgeon General has concluded that e-cigarette aerosol is not safe. Unfortunately, these flavored products leave no telltale odor on a user's breath, and 97% of youth e-cigarette users use flavored products. Most youth start vaping because of the flavors, and flavors also mask the harshness of tobacco and make them easier to use. In addition to using flavors to entice kids, vape companies tried to promote vapor lounges and cool launch parties and would target kids on social media. JUUL spent at least $1.6 million on marketing its launch and directed its marketing to the social media used by adolescents by using images that associate vaping with being cool, hip, and having fun. JUUL is trying to persuade regulators that the soaring teenage use was an accident, not a deliberate marketing strategy. Another popular social media trend are vape influencers. These are teens who are sometimes underage who promote products and are paid by vape companies. They show tricks known as tricking and record videos for followers and fans, which are mostly other teens. Stealth vaping is the act of vaping in a discreet manner. Using small vapes, the user can regulate the exhaled puff size to be barely visible. This form of vaping works best with concealable devices. Stealth vaping can also involve the user swallowing to avoid breathing out the aerosol exhaled. Stealth vaping is basically to avoid any detection. Online videos instruct how to swallow to avoid exhaling aerosol vapor and also instruct how to vape without anyone knowing, such as keeping a hair tie on your wrist to keep the device hidden, or hiding your device in a cup to look like a straw or a Sharpie marker. This practice can also be referred to as zeroing the hit. Vape watches and vape phones are more ways to disguise and conceal your vape. Same with vape sweatshirts and vape backpacks. Puff bars are disposable vapes that have become extremely popular among youth. After their legal scrutiny, JUUL pulled some of their flavored pods from stores, and some other cartridge-based vapes could only sell their pods in tobacco, mint, or menthol. However, more diverse flavors can still be sold online. But disposable vapes are still being sold in stores and come in many flavors that attract teens. These devices can be used to vape other drugs, mainly alcohol and marijuana. Dabbing is vaping tiny balls of marijuana wax that are highly potent and concentrated THC. One dab hit could be equal to a whole joint or more and produce an intense, dangerous high. Other devices are becoming available that look like USB flash drives to vape drugs. Pax Era is a marijuana delivery device that looks like JUUL. We also hear a lot about CBD vaping among youth because it is technically legal, but we have no data on the health implications for youth vaping CBD. Also, CBD can look and smell like marijuana, so it can be difficult to know if a kid is vaping CBD or marijuana. Even if kids are just vaping nicotine, nicotine is a stimulant, meaning it raises your blood pressure and increases your heart rate. When you are relaxing, your brain and your heart are calm. When you use nicotine, your mind feels calm because it's filled with nicotine, which is releasing the feel good chemical dopamine, but your heart is pumping really hard and is not calm. Nicotine is fast acting. A traditional cigarette can get nicotine to your brain in 8 to 10 seconds. However, vaping research shows nicotine salts can be absorbed at a rate 50% faster. Nicotine can harm the developing brain. The brain keeps developing until about age 25. Using nicotine while the brain is developing can harm the parts of the brain that control attention, learning, mood, and impulse control. Each time a new memory is created or a new skill is learned, stronger connections or synapses are built between brain cells. Young people's brains build synapses faster than adult brains. Nicotine changes the way these synapses are formed. Nicotine is considered one of the most addictive drugs because it works so quickly to release dopamine in your brain, but the euphoria feeling doesn't last long. Withdrawal symptoms can start shortly after nicotine leaves the body, triggering the need for more nicotine, so getting addicted to nicotine can happen quickly. Using nicotine during development can also increase risk for future addiction to other drugs. People who are addicted think that a hit from their vape relaxes them. What it's actually doing is calming the symptoms of nicotine withdrawal. That's why they feel better. Nicotine withdrawal is very powerful. When someone is going through withdrawal, this can be a sign of addiction. Someone who is addicted may make choices they wouldn't usually make because their brain thinks it needs what they are addicted to. Just like the withdrawal from other things like drugs and alcohol, a person's body will react negatively when it doesn't get the nicotine it thinks it needs. Students should understand that vapes are not a safe or safer alternative than traditional cigarettes. They are both dangerous and in very similar ways. There is no solid evidence that shows vapes are safe or even safer than traditional cigarettes. Who's ever heard that a JUUL pod has the same nicotine as a pack of cigarettes? Most people have heard this and believe it to be true because it's been so widespread. Even healthcare agencies have said this. But where does this information come from? The statement of one pod is equivalent to one pack of cigarettes comes directly from JUUL. Every time you see this statement, it is preceded or followed by according to JUUL, the manufacturer, or it will cite the JUUL website as its source for this information. There is no study or independent investigation into this statement. We all just accepted it as truth. Guess what? JUUL no longer makes this claim on their website. It's not anywhere. This is a screenshot from April 2018, but this statement has since been removed. So what's the truth? A pack of cigarettes has 1.23% nicotine concentration. A JUUL comes in 3% or 5%. That's about 4 times as much nicotine. JUUL had one of the highest nicotine concentrations available, 5% when it first came out. It's so high that other countries have banned it. All of this is, of course, assuming that the JUUL company and others like it are telling us the truth about their nicotine content. So why target youth? Because these companies know that 90% of the introduction to nicotine, including vaping, happens before 18 years old. And once kids are addicted, they're addicted for life. Teen e-cig users are also more likely to start smoking than non-users. We're also finding that young people who vape nicotine were significantly more likely to have ever vaped marijuana than their peers who didn't vape at all. Usually because of cost or availability, youth might switch from vapes to cigarettes because the drug nicotine is the same in both products, and once they're addicted, any form will satisfy it. Luckily, on December 20th, 2019, a federal law was passed raising the age to purchase all tobacco nicotine products, including vapes, to 21 to purchase. The FDA also did ban some flavored e-cigarette cartridges only in January 2020, but not mint or menthol flavors. Unfortunately, flavored liquid nicotine and flavored disposable e-cigs like puff bars are still sold. There are opportunities for youth to take a stand against big tobacco and e-cigarettes, and students have the power to positively influence other students. According to research, the best person to keep young people from smoking and vaping is another young person. Parents and adults also play a crucial role. Research shows that when parents voice a strong disapproval towards vaping, kids are much less likely to try it. So it's crucial for parents to be educated and to have the resources they need to talk to their kids about this issue. Here is my contact information for any questions. Thank you for listening.